So people with mental illness, they're typically your more highly dependent smokers. They're probably going to need more support along the way. They may have medicines that need adjusting. You need to involve their GP and their mental health support workers. Don't work in isolation. You're not the only one involved in their care. But do map out their care plan. Make sure they know what to expect. They're going to have withdrawal symptoms. These are going to be very strong at times. But there is a light at the end of the tunnel, and you're there to help them get through that tunnel. It may need more support from you. You may have to go outside of your normal bounds of helping people stop smoking. It's about tailoring, making sure that you've got the right program for them. One of the other concerns I often hear is, well, what about people with mental illness? Isn't smoking good for them? And so when you stop smoking, their mental health's going to get worse. Now, I remember the days when you could smoke anywhere. And when I was doing my psychiatric rotation, you'd be in there with the office, with the psychiatrist and the patient, and they'd both be smoking, which was always quite bizarre. But you'd sit there and there'd be plumes of smoke around. It was just part of mental health services. And it's kind of been the last bastion, I suppose, where people have said, well, you know, it's the least of their worries. They don't need to stop smoking. Their mental illness is more important. Well, people aren't dying of their mental illness. They're now dying of smoking-related illness or illness related to obesity. These are the big killers. And many people with mental illness want to stop smoking just as much as those without. And we've got a duty to try and help them. Now, just so you know, there is evidence to show that over time, symptoms of mental illness get better, not worse. So people become less depressed, less anxious, less stressed when they stop smoking long term. In fact, we might even say that smoking is bad for your mental health. Stopping smoking can result in changes to some drugs that your clients might be taking. The 4 drugs that you need to watch out for are clozapine, olanzapine, warfarin, and theophylline. The first 2, clozapine and olanzapine, are used to treat mental illness. Warfarin is a blood thinner, so some of your clients that have heart disease may be taking this. And theophylline is a drug that's not used very much anymore, but may be used for people with asthma or other respiratory illnesses. Now, you don't need to panic about this when you see clients on these medicines. All you need to do is highlight the fact that stopping smoking might change the levels of these drugs. Refer them back to their GP, maybe even write a letter to go along with them explaining that they're stopping smoking and that these drug levels should be checked. Many women manage to stop smoking on their own when they find out they're pregnant, but a number don't. And those that don't are typically your more highly dependent smokers, and they're going to need some extra help from you. Again, they may need more regular follow-up. You can use nicotine replacement therapy in these women, but you might know that the patch needs to be removed overnight. The prescription medicines are contraindicated. Some stop smoking services are using incentives to help keep these women on track, and that's a good thing. Make sure the program fits with them. What else have they got going on in their lives? They may have young children. It may mean that coming to see you at 9 o'clock on a Monday morning is just not possible when they're trying to drop all their other kids off. Work with them to develop a plan. You will need to put more effort into some of these clients, and that's okay. They're our priority populations. So make sure that you do prioritise them within your programs. Those with other drug and alcohol problems, they also tend to be more highly tobacco dependent. For them, stopping smoking may be harder than quitting some of their other dependencies. Again, work with them. Make sure your program fits their needs. Remember, if people are going to relapse, they're much more likely to relapse within the first week. Don't wait for them to call you. Make sure you're contacting them on a regular basis. And again, involve the other healthcare professionals that these people see on a routine basis. Remember, we're trying to help people stop smoking. And for some people, they're going to need a higher degree of support than others. And that's okay. Your program should be flexible enough to really cater for the needs of everyone. One size doesn't fit all in this treatment you'll need to think clearly about who you're helping to quit smoking.